Thank you for coming to my presentation. Today, I'm going to talk about three key facts you should know about chronic pain. Uh, this is the interesting topics, and I'm specialized in chronic pain. And I took some courses that's listed in the below, like cognitive functional therapy and pain reprocessing therapy and explain pain. So based on those information, I created some information that's the evidence-based, research-based. So I'm going to introduce those three key facts. It's hard to summarize all the information in 1 hour, but hopefully I can share like some useful information so that my goal is to, like everyone who have been struggling with the chronic pain to be able to, back to the valued activity, or, hopefully hopefully reduce the pain, but at the same time, the not pain controlling you, you are the one able to control your activity in the life. So that's my always the goal. So first, before we begin, I'd like to acknowledge that I'm speaking to you from the traditional, ancestral, and unceded territory of the Self Nation where we live, learn, and play, and collaborate, and work together. And quickly, I'm going to introduce about myself. I'm the Kaz Kikuchi. I'm from Japan. I moved here in Canada 2009. I had a bachelor's degree in Japan, physical education, and after that, moving to Canada 2009. And I started as the personal training, and I love to work with the people who have the kind of like more spinal cord injuries, and so I enjoyed that, and I had the passion to help other people who have difficulty with the mobility. So I got into McGill University. And after I graduated from the physio program in McGill, I moved to Corona and I started working at KGH, Corona General Hospital. And now I'm working at the clinic MoveMed therapy, and I specialize in the more chronic pain and treatment. So in terms of the chronic pain trainings, I quickly mentioned, but one more time, I specialize in kind of like a chronic pain. I took the course like a pain reprocessing therapy and also cognitive functional therapy, and I'm part of the Pain BC mentorship network for the pain, mental health, and substance use. So I still learning the many things, but I feel like I don't know more things. Like if you know more, and sometimes you don't know more. But is very interesting. Like approach, modern approach is totally different than what I learned in the physio program. So hopefully I can add some great valuable information this in this presentation. And the picture beside me is on this picture is my family. This is an old picture. I have two kids. My daughter is as tall as my wife now, so I need to update. But I have two kids right now. Okay. So the objective for this presentation is to learn what's the pain. What is the pain? That's the first thing. And what things can influence your pain experience? That is the very interesting. And what are the three key concepts that you should know about the chronic pain? That's what we're gonna do. And first, I think that our brain is very interesting. So I want to see how our brain works. So first things, the picture. What do you see? This picture. Maybe some people see, already seen this picture. If you have, know how to use Zoom, can you send me the like a chat message? What do you see? I don't want to just say it, but people say that maybe two animals or something. I don't know. Yeah. What do you see? Duck. Oh, rabbit and duck. Good. Okay. Yes, exactly. Bird, rabbit, duck, exactly. How you see. Test. Oh, yes. Yeah, you can test it. But yes, both are fine, is correct. You can, some people, here is, like the eyes and some, the screen, the beak side is maybe the ear, the rabbit's ear, or other way you have the like the duck kind of the beak. So you can see the two ways. And another one, how this is the normal things. I think the people see 12, 13, 14, isn't it? But if you see this one, how do you see? I think you see A, B, C, isn't it? But B part and 13 is exactly the same. Yes, A, B, C, that, yes, perfect. Exactly. Is the part in the middle part is B and 13. But what we see is depends on what comes the front and the after. That's our brain works. How about this one? The experiment that some people did, put the hands in the ice cold water one hand and other hand in the very warm water, the hot water, and after that, when you put the just the same, just a room temperature water, what you feel in the hand is the different. One side is the cold, one side is warm because based on the previous experience you had in each hand, you even though you have the same temperature of the hand, each hand feels different. That's very interesting because perception from how you experienced it before influenced how you are experiencing right now. All right. And so that is the very interesting things. Another thing, humor things. Oh, hold on. Okay. Humor things. Which orange circle is bigger? So sometimes, I feel, right side is bigger or left side is bigger. Uh, there is like people say you feel that like one side is bigger, but to be honest actually exactly the same. So how you see is based on the other context of the other environment as well. It's not only the visual things, it's not only the things, sometimes is the audio as well. How you look at how you hear is the different. So I'm gonna do one thing. Let me know if you hear anything. Do you hear? Did you hear? Okay, I'm gonna do exactly the same things, repeat again. If you hear, how you hear. Do you? One more time. I'm not sure if you hear or not, but like even though you feel increasing, and when you repeat, continuously feel like the increasing, that's how the brain is perceived. So I want to emphasize here, hold on, I'm going to put back the earphone. Okay. What I want to emphasize here is our perception is the contextual. What does mean the contextual is contextual means depending on or relating to the circumstance that form the setting for the event or statement or idea. So what does that mean? That means is that how we perceive something is influenced by the surrounding environment and the situation and other factors that provide the context. So the why this is important is the pain is the perception of our body, and the brain perceived some signals, and sometimes based on your past experience, based on on your like the someone's story, based on the feeling and those things, is sometimes changes the sensation as well. That's why it's very interesting to see that they can feel the experience that those how I perceived, perception, and that's what we did. And what I want to introduce today is basically like one study that published in the Journal of the International Association of Study of Pain. And they studied, one of the study groups studied about what do people value learning about the pain. So this study is analyzed the data of 97 participants, and they asked those questions about what concept that they felt very valuable, and those people who had suffered persistent pain and improved after the pain science education intervention. So people who had persistent pain but improved, and they came back saying that what kind of information was very valuable. So that's why those are three key concepts is we're gonna talk about today. So this is the important thing. So first concept that I'd like to share is pain doesn't mean our body is damaged. Pain doesn't mean my body is damaged. So by saying that, I want to introduce one stories. This is published in the British Medical Journal, a very prestigious medical journal, and this is published in 1995. If you are one of my client, maybe I told this story many times, but you can listen again. And this is the boots. One construction worker wearing the boots, and one day he stepped on the nail, and the nail went through the boots, and he had excruciating pain. Of course, nail went through the boots. And so he needs to go to the hospital. So he got an ambulance that he went to the hospital. On the arrival at the hospital, the doctor tried to take the boots off, but he experienced so much pain that the doctor needs to sedate him. So patient was sedated and the doctor slowly took the boots off. Actually, nail was in between toes. There was no structural damage so whatsoever, but he had pain. I'm not saying this is the experience, telling that so he had, like the pain was in your head. It's not all the pain is true. It's not saying pain is real. I hear you. I believe you. I 100% you have pain. He had pain, but What's what causes the pain is the different. The brain perceive the pain is depends on the how you feel, how what's the kind of contextual, like the situation, kind of circumstance. Um, he's in. That's the based on the how he feels the pain. So pain is true, but there was no structural damage in this story. And another story, I don't have the picture, but another story that I normally share with my patient is the when sometimes people used to go to war. So war situation, of course, they had some like injuries during the war. And after the war, they go back to the country and injury, everything healed. But when they hear the sound of the helicopter, every time pain comes back. There is no structural damage, but body remembered. Maybe some harder. There are many, many stories like that, especially like that those are the case. Pain is increased or the felt by some other the environment factor. But I heard another story that the shark bites. People who have got the shark bite, they don't feel any pain. And when they go to because they need to escape the situation, they go to the shore. Then when you hear the sound of the ambulance, when you relax, they feel pain. So pain is very interesting in is interesting. That's why I want to study more. I want to kind of like learn more and keep learning. And that's where I am now. But like I'm gonna show you another interesting fact. This is the asymptomatic patient. So those people don't have any pain. So let's look at the 50 years old disc degeneration. People who have the disc degeneration, but 80% of people don't have any pain. How about of the disc bulge? That's the disc herniation kind of stuff, the protrusion, same kind of stuff. So disc bulge, they 60% of the 50 years old at the age of 50 don't have any pain. If you go older than that, you have little more people who have the condition but don't have any pain. Are we gonna treat the condition if you don't have the pain? I'm not sure. But this is the fact. Some even 20 years old, people, they have the disc degeneration. 37% of the people disc degeneration, but they don't have any pain. So some people who don't have any back pain and grab those people and put some diagnostic images, they might have some like those conditions, but they don't have any pain. All right. So make sure that like the images, the findings from the image and your pain is corresponding as well. And sometimes those people who didn't have the pain, but when you are told by the healthcare professional, then start feeling the pain as well. Why? I don't know. So very interesting that like the things in between the pain and the other, like the thoughts, emotion, and as well. Not only the spine, this is asymptomatic patient. This is the results that the extracted from the running clinic, but that also hips as well, and the knees and the foot, maybe like small letters, but always have this asymptomatic the defect as well. So we now say that sometime the degeneration of the disc, that's exactly when you get older, that's going to happen more. So same as the wrinkle on your face, is that a problem? for some people, but if you wrinkle on the face, like that's normal. That's the like aging, normal aging. The gray hair, similar things. So um, with as long as like you have the pain is not the corresponding to the the images that you find, we are kind of it's okay. It's normal to have the degenerative disc as well. So we are telling that so that the sometimes patient gets more, oh, it's okay that that those things have, so that they have the more feeling the more safe to have those conditions as well. So, what is the pain is basically like the definition of the pain is the changed in 2020. First, like a definition of the pain was created in 1979 and recently changed. And so, what they changed the definition of the pain is an unpleasant sensory and emotional experience associated with or resembling that associated with actual or potential tissue damage. So sometimes the pain comes because of the like the potential tissue damage doesn't mean that your tissue is damaged, all right? So what I want to say, the concept that today, the one thing that the people valued, that the to in order to reduce the pain, persistent chronic pain, is pain doesn't mean that the body is damaged. That's the one thing. Pain doesn't mean that the body is damaged. So pain is the danger signal. It's not the damaged signal. All right. Pain is the danger signal, but it's not the damaged signal. That's the one thing. That's the one concept. So next one is thoughts and emotion and experience affect the pain. So why I'm having the pain? That's the normally have the questions. If you say that the my structure is okay, why is I'm feeling the pain then? Or the injection and sometimes they didn't work. Why still having pain? So that's the question. Sometimes because of your thoughts or emotions and experience influencing your pain experience. Sometimes you can have the both as well. Little bit of the structural pain, but amplify those pain is amplified by your thoughts or emotions or negative past experience and trauma and those things. Okay. And so I normally explain about like the use as the hearing aid concept. So what is the hearing aid concept is when you have the pain, you are kind of very vigilant. You are kind of paying attention. So all the pain is like the sensation is amplified. In that case, normally you feel the pain, to pain, your volume is up. So you feel that a 7 out of 10. So after that, you are feeling it a long time, which is called a chronic pain. Your volume is still 7. Even though you feel that your structurally, your structure is healed, but your volume is still 7, so that any other sensation felt like the pain. And that's the sometimes like you feel like a small amount of the sensation, but amplified by the past experience because of the fear, because of the other emotion or thoughts. So in order to do that, you need to dial down your hearing aid as well. How we do is different individualized the approach is the key. But I'm going to show you some example. And what predicts the chronic lower back pain? So sometimes this is the multiple studies that shows the what predicts the chronic back pain. One is the negative mindset. So my back is suffered and will never get better. That's negative mindset, just the damaged. I might, I feel more, damaged when you move. I don't want to make it bad and never get better, those things. All right. So that's negative mindset that can definitely influence. And also the contextual factors, always using the crutches. Crutches means the people who got like a pain. So it needs to do the, like those contextual factors and past pain experience. I normally takes a long time to get better, or my healing is slow, and the general health and mental health, a little bit of depression, or like generally not health is good. Those influence the other things. So negative mindset is here, and those other, like contextual factors brings back to the kind of the more negative emotions. That's the more pain-related fear. I'm gonna explain what is pain-related fear and distress. And those things is the feeling that like an unhelpful coping. So what are you gonna do is resting because I don't want to damage my back. All right. I don't want to move. I don't want to hurt myself and avoid things, or I cannot do that. Maybe I shouldn't, do bike ride. I shouldn't walk. I shouldn't bend my lower back. Overprotection. All right. Protecting the guarding more. And poor sleeping. Sleeping is also very important for healing, but the sleeping poorly, so that is effect. That's consequence, that's a result in more disability and the pain persist. So those are the things that very influence and affect your pain experience. And what is the what is the pain-related fear? There's the two types of the fear. There's the fear of doing harm. So I am causing more bad to my spine. Or another thing is I'm fear of feeling pain because pain is bad. Pain is damaging my body, like a structure. So those are coming to your head. That's kind of like the more the increase your fear and sometimes avoid some of the movement as well. And the pain related fear is also as well as your feeling of worry, nervousness, and those are things unease. Those are things that is influence your pain as well. Because sometimes you worry about it. As I have the patient that she fractured the ankle and she has they always have pain. But like even though she is not moving, she feels pain. That all right, and maybe some of you that maybe like related to that. But like the one time that she's working with me and and talking about all the thoughts and the emotions and those things, and I told her that the pain doesn't mean that the damaging your body is okay. Sometimes you need to go through the pain to get to the function as well. It's okay, and start moving and getting better. And she mentioned one time is how much, I was thinking about my ankle constantly all day, 24/7. That was the huge. And the pain is don't have the sometimes don't feel pain and forget about it. That is the, like a really, uh, like I didn't know that how much I was thinking about it. So sometimes people, who have the pain, they're thinking, all the time as well. All right. And so there may be some are worried or, the different like the thoughts as well. And other emotions is common emotions is like sometimes anger is influences stress, frustration, Sometimes the people died. Then I recent study that shows that when you lose someone, you feel pain, even though the diagnostic images doesn't show anything. You feel pain, but that is real. But it's not coming from the structure. Just like a different the emotions and thoughts increases the pain and the sadness and depression as well. And very interesting study published in the proceeding of the National Academy of Science. That's the bodily map of the emotions. So what is mean by that is each emotion creates the healing in the body different way. So this study is analyzed the 701 people, and each the participants exposed to the emotional world, stories, movies, and facial expressions. And what they find is each emotion has a different the response of to the body response to the emotions. So the red, like a more orange part, is the more warmer, and the darker and the blue part is the colder. So when you're angry, you feel more, like the head and upper body, arm part is gets warmer. And fear, you have the more hot part is more warmer. So I don't want to go through everything. You can take a look at it. And I want to show this one because of the each emotion and thoughts, those things uh, is influence our body as well. All right. That's a very interesting study. And how we're going to explain and normally in the clinic is anger, fear, stress, negative emotions that's create is the fight or flight response. So you're going to go more like get nervous. Okay, that I gotta do it, and nervous system gets really tightened up, and the more breathing get more faster, and heart rate get higher, and that's the fight and the flight response. All right. And then that means the more your fight or flight is a danger signal. So like a more likelihood that you will interpret those some of the sensation as the threats. Okay, I gotta run. If something happens, I gotta go. It's more danger signal. What's gonna happen is the more that I said it all the danger signal, start interpreting the sensation through the lens of the danger. I am going, I'm gonna have it, needs to run away. I have some patient that he had one time running on the trails and the bit by the snake. And after that, every time when he lands and touched the leaf or something touched his legs, painful because like a past experience can create. And those are things, and also feel pain. That's the one. When you feel pain and you get the more fear, I don't want to get damaged. That's the backward, the really downward spiral. So we need to recreate the kind of like the reprocessing the system as well. So what I want to say here is it's not structural. Only the structural increase the pain is emotion and thoughts and other things that the stress and sleeping, other things that can cause or amplify pain experience as well. So I don't look at it sometimes, especially people who have the long time pain, chronic pain. I don't, of course, I look at the like a structure, but I'm not looking just at the structure. The clinical tool I'm going to show you is I'm gonna point to everything. That's why I ask so many questions about the past experience, how you feel about it. So this is like what I kind of investigate what we need to work on. So more cognitive, what's understanding of the pain education. Today is the part of it. So like the first of all, is the pain doesn't mean that you are damaged or other emotional things, emotion thoughts, and other things can influence the pain experience. Do you understand those things? Do you believe that, or what you believe? Those things are cognitive. And the emotion and the physical activity. Are you engaging in the physical activity? Pathological anatomy. So is there anything going on? Okay, the disc degeneration. Okay, is that matching with the like the diagnostic images, and those are the things. Is the lifestyle? What is the lifestyle? Social. Are you isolating, like, not avoiding any social events and those things? And sometimes sensory is the like touching is very sensitive. All right. Sometimes those things and general health, those are things, everything is included, and then we're gonna. I'm, like what's the way, what's the approach is the best approach. And this is not like a physio can do everything. And the key here is for the chronic pains to have the team around you is the key. So it's not, like the physio, the people who understand it, like massage therapist to, like social worker to the doctors to nurse and the counselor. You have the team around, people understand and the pain, the teamwork, and you are the center, what you want to do. So you have I ask the valued activity. What's your valued activity? So I want to get back to you. And I want to do one time, young the gentleman who had two young kid, and but because of the back pain, he couldn't pray. Constantly thinking, I just want to pray with my kid without thinking, or I just want to go for the walk. Yes, that's I want to get you do that. All right. So that's as long as you have the activity, I want to help you. And if you say someone that say, oh, you need to live with it, pain is that, like you cannot now get rid of a pain with it. Actually, next one is that a very good concept that I want to tell you is I can retrain my overprotective pain mechanism, which means it's possible to change. I can retrain because overprotecting pain system that they're causing the pain. So make sure that those approaches it can be different, but like the pain can be like reduced or activity can be resumed, even though you have the little still little pain because you are safe to go. I'm gonna quickly check uh, the chat. When does the protection for when does protection from injury become overprotection? So that is the good question. So protection is sometimes there is some past experience, or sometimes like you have the how much pain you have, what do you believe, and those things. And overprotection is basically like you're guarding so much. So I have a good example that the people who have low back pain, okay, and the people started having the okay. Somehow I heard that you have the bad posture. That's why you have the low back pain, and you have the pain. Somehow, maybe you did too much one day, like the activity or the cleaning or something. You have the back pain. But when you go to the doctor or something, you get the images, you had some like a degenerative disc or something. Okay. And over, I have the degenerative disc or some like the disc bulge, so that the people, okay, I need to sit straight and everything. I don't want to bend because of pain. I don't want to, like harm my body. Imagine you are keeping the posture like this. Muscle core, and you go to the some like, physios, you gotta okay, you need to work on your core engaged, everything. So you cannot move like this. Engage your core, make sure you do. If you make the everyone, if you are in front of the camera, hold the fist like this. Really hold tight for 30 seconds, even 30 seconds. You, and I want you to try to bend your wrist. It's very hard. And those people who have lower back pain, moving very slow to protect your back. And now I know people, some people has, oh my God, 30 seconds, so much pain. That's you do 24/7 all day because you don't want to hurt your back. That's overprotection. Somehow you want to maybe hard your story. Those people you don't need, sometimes that's why it's important to individualize because maybe some people need a core for time to time, but some people needs to relax. It's okay to slouch. Very interesting study that shows that people who have the nice posture is normally people who have lower back pain, and the people don't have the lower back pain, people slouch. It's okay, relax and those things. So of course we need to eliminate the structurally okay. It's called unexplained the lower back pain, but based on the assessment and all the other things, sometimes need like the diagnostic images, but sometimes because of your like the imagination of the movement is like the damaging our body, or you hear from the something your past experience, that's become the overprotection. That's the hopefully I answered the question. So depends on the there is no one way, but the multiple kind of things, maybe thoughts or fear, stress. Sometimes stress causes the like the more rigid and those things. That is can be the more muscle guarding and those things. But um, the converted concept number three is I can retrain my overprotective pain system. So it's possible. Why? How is that possible? Is that it's the word called bioplasticity. What is the bioplasticity? Maybe you may before heard of the neuroplasticity. Neuroplasticity is the brain can rewire. If you have the one part of the brain is is damaged, the brain can rewire different way to create a function. But the bio is means that the whole body can and adapt the adapt to be able to create a function. So bioplasticity refers to the body's remarkable ability to adapt and change in response to the stimuli and encompassing not just the brain, that's what I said, but all bodily system. So I've been kind of like I heard this like bioplasticity from the professor that she is big into the chronic pain research is the Tasha Stanton is the University of South Australia, and they do the she's part of the NOI group, which is the pain explain pain, and they do the lots of the pain education. And I had it, what is the bioplasticity? But basically, like, is bioplasticity is the key to change your overprotective system, relearn what is already learned pain reaction, but it's possible to change. And Noi group is explained that like bioplasticity is the reason to be hopeful for anyone experiencing the persistent pain, no matter the condition or duration. It's all about learning how protective system can be tuned down, even switched off by thinking, moving, speaking, knowing, and believing differently. So you need to kind of like what you believe, what you think is yes, you have, but to turn the protective system off, you need to kind of like moving differently, thinking, and the knowing and the behaving differently. And it's not easy. It may not be easy, but even just knowing of the bioplastic potential of all the bodily system is surely a start. So there is not easy, but we can kind of make the change for that one. And humor slide. Is the pain reprocessing therapy, very interesting things that they find that 151 people with mild to moderate chronic back pain. And they randomize clinical trial, so randomly assigned to which treatment that the intervention that they are going. One is the pain reprocessing therapy, PRT, that is more, education and the safety appraisal and seeing the feeling that moving through the lens of safety. That's the more kind of psychological approach. And the placebo is that they receive like a saline injection on your back. Usual care is just doing the normal care, sometimes rest, and don't not adding the new treatment. And after 4 weeks, basically, either the pain-free or nearly pain-free people is pain reprocessing therapy. 66% of the people got the pain-free or nearly pain-free. Placebo is 20%, and usual care is the 10%. So chronic lower back pain, so like how much important to approach. Of course, it's not gonna mean you cannot do the, sometimes, like the structural things, like the massage, kneeling, those things. It feels good. There's not gonna mean that you shouldn't do those things, but how much important to cover different area as well, including like emotion, the stress, what are you going through, how are you reacting to the pain? Because I talk about the react versus responding to the pain. Reaction would be like why I'm pain, why I'm, like what's going on, what my back is, is going on right now, or responding to the pain, I didn't do much, like actually, like I haven't changed any activities. I didn't, do much, no extreme like changes. That means is my back is it shouldn't have injured anything. Okay, maybe sometimes stress, or maybe structurally my structure, okay, maybe stress, maybe I didn't sleep well, maybe I feel a little bit of, the fearful. So addressing those like paying attention your emotion and thoughts and the different things can be the kind is the good things to approach the chronic pain as well. Um, and the last thing, this is the cognitive functional therapy, and just 1 minute of the video. So I'm gonna show you. I went to take the course from him. He's from Australia, and he came to Vancouver. So I went to see him. I wanted to. Lots of the people from all over the world came to take the course from him. So very interesting approach. So I'm gonna just play only 1 minute. So can you hear? Is okay? Okay.
My back pain was quite severe and caused me a lot of trouble when I tried to do basic things. Even the simplest things like tying my shoelaces were a difficult task. Anything that involved bending or lifting weights off the floor wasn't something I would even consider doing, even sitting for extended periods of time. So, for example, giving my daughters driving lessons in the car was always a very difficult thing to do. I was getting quite frustrated and depressed about it as well.
Cognitive functional therapy is a complete U-turn on what's commonly done in normal practice. And that our understanding now from the research is that chronic low back pain is usually a sign of overprotection of the body. And so the kinds of things that people are told actually make them worse. Where actual fact, we know what's healthy for the spine is to relax and move and engage with activities. And so the trial demonstrates that there are effective treatments that are safe and are relatively inexpensive for people who've gone through a tough journey and really feel like they're stuck at the end of the line.
My pain is virtually gone. So I was basically able to go back to all the activities that I enjoyed doing, including gardening, car maintenance, lifting a cylinder head of an engine without any difficulty, which I wouldn't have even attempted before the treatment.
So, so the very interesting to kind of like the learn from him because as I said at like the beginning, and what I learned from physio school was it's kind of like, oh my God, this is true, and like, can I do that to my patient and those things? But definitely is very interesting things, and I learned is open mind, just being open mind, seeing the other, like the way other approach, or maybe being the like other thoughts and the emotions, the other things that can create, causing the pain. Those kind of open-mindedness is the huge components. So that's my the presentation, and the takeaway home. The message is pain doesn't mean my body is damaging. So pain is not the damaging signal. Pain is the danger signal to our body. And so keys to reduce the danger signal. How are we going to do that? That's the I cannot tell you in this different like the virtual setting, because of each person is the different. So you need to kind of like finding what is causing the danger, why you stressing, what's the kind of you feel the fear. Those things needs to dig in. And of course, eventually you are feeling it is the one movement is fearful doing it. You need to be exposed to those things, but a gradual way. Um, and um, and thoughts and emotions and some past experience, past trauma, and those things can affect the pain as well. So it's not sometimes the structure, maybe thoughts and emotions and past experience. And the big emphasis on the you can retrain your overprotective pain system. You can get better. So it's possible to change. So this is the someone is told that you need to live with it, and you need to kind of like cannot do something. I tend to not to believe that. I hope, as long as you believe you can do it, I will help you as much as I can to get better. So yes, you have the hope to get better as well. So this is the end, and if you want to start, like definitely, like you can do the, interest in personalized assessment. Contact the info at the movemed.ca and the movemed physiotherapy. Definitely, like we can get you to the, share my thoughts and the assessment as well.